November 17th, National Rural Healthcare Day. What is it, you ask? Well, National Rural Healthcare Day was created to encourage young adults to pursue a career in the exciting and ever-changing world of healthcare, especially in the rural setting. The rural setting has seen a decline in healthcare providers, but this decline comes as a surprise to some people. Many staff members of the Davis County Hospital believe this setting and this job choice is one of the best you could ever make for your life. When I spoke with them, they had this to say.
I am the CEO here at Davis County Hospital. We are a rural critical access hospital, which means that we have 25 beds. We also have 32 beds of long-term care. This is really important to me because I believe in rural health care we need great people, and we have a great team here at Davis County Hospital that takes care of our patients. And it's really important from talking to young people who are thinking about what they want to do after they get out of school to talk to them about why you should be in the rural America. It's a great place to live. It's a great place to raise your kids. The people that you meet in communities like ours are genuine people. They are great people to work with, and we're just really lucky to have such a good facility here in our area. I just want to encourage people to think about if I know a lot of people a lot of kids when you get to the point, because I did the same thing when I was thinking about what am I going to do when I get out of school, where do I want to go. I know a lot of young people think, I'm not going to come back to where I went to school. I'm getting out of Dodge and I'm going somewhere else. I would just tell you that maybe you aren't going to come back to your hometown of Bloomfield, but I would encourage you to think about going to another small community. If you don't want to come back here, think about going to another small community in Iowa or in another state, because there are people, we have a lot of elderly population, and there are a lot of people that need great care, and a lot of good things happen in small places, especially living in rural America. It's a lot less expensive than living in the city, and also it's just a safer place to be.
I grew up in the area, moved away for about 10 years, came back for the hometown experience to raise the kids in that atmosphere.
That's a great question. I chose rural Iowa because I grew up in a small community. I grew up in Winfield, Iowa, and we liked the small hometown feel of rural Iowa. You also get to do a variety of things in small town healthcare that you don't get to do in larger cities. In a larger city, you have a more narrow practice because there are other specialists, there are other physicians, and here you have a little broader type of practice, which is rewarding. So,
the rural setting is important to me because not always do people in rural areas have access to the things that are there in the big city. And so helping the people within your community and staying at home, even though I don't live in this community, the rural area is important and needs to be served well. And so that's why I stay in the rural setting, to help meet the needs of people in the smaller areas that can't get out to the big cities.
I chose Davis County Hospital because of the sense of the community and, the sense of family that is present among everyone that works here.
Well, I enjoy taking care of people, and I knew I needed to do something when getting ready to graduate high school, and so I decided, you know what, let's try the healthcare industry. I decided I could do the radiology program locally there in Indian Hills, and so I decided, let's go that route. So I ended up doing that. It wasn't like that was what I dreamed of doing my entire life, but I decided, hey, let's try this, and so I ended up in it, and been doing it for 6 years now, and enjoying every bit of it. So
I chose healthcare for the opportunities for growth. I chose healthcare because it's something I could do right here at home.
Oh gosh, the benefits are it's challenging and rewarding in that way because it keeps me on my toes, and it's ever changing so that it's not the same thing every day. And for me personally, I like that because it keeps me stimulated, my mind, and keeps me learning.
the healthcare is an interesting field just because there are always new things to learn. It's an ever-changing field, so you're not going to run out of stuff to continually be learning about. Plus, there's always opportunities. You go into a certain field within healthcare, a certain subfield within healthcare, and then there's always opportunities to branch off from there within the hospital. So that's always nice too. So
the benefits for nurses are nearly endless. There is opportunities for advancement. There is accelerated pay. There is a variety of hours and schedule that could meet your home life needs. There's also tuition assistance and tuition reimbursement and shift differentials, good retirement.
Spending the time at the bedside and making a difference with the patients that you're caring for is just something that you can't put into words. I feel like when I leave at the end of the day, even though now I'm not at the bedside, I'm an administrator, I still have direct impact on the outcomes for patients and their families, and so it's more of an emotional and a heartfelt thing that speaks to me than the financial.
So, as you finish up or continue your high school years, look past your dreams of escaping and focus on a reasonable, well-planned goal. The healthcare field offers many opportunities right here in Davis County and other communities just like it. When deciding on your future plans, one should stop and pause on all of the opportunities and benefits of the healthcare field.